What's up everybody, Dr. Mike here, and welcome back to the channel. Today, we're talking about antibiotics, the superheroes of the medical world. But just like superheroes have their special powers, different antibiotics work against different types of bad guys, aka bacteria. Understanding the different types of antibiotics and what they treat is super important, not just for medical professionals, but for everyone. Knowledge is power, and knowing about your medications can help you advocate for yourself and make informed decisions about your health. So, let's break down these antibiotic classes and see what they're all about. First up, we've got the penicillin class, the granddaddies of the antibiotic world. Discovered back in the 1920s, penicillin was a total game changer, saving countless lives. Now, penicillin works by attacking the cell walls of bacteria, basically making them burst open. It's super effective against a wide range of bacterial infections, and you've probably heard of it being used for things like strep throat, but penicillin isn't just for sore throats. It's also used to treat some pretty serious infections like syphilis, a sexually transmitted infection, and meningitis, which is an infection of the membranes that protect the brain and spinal cord. Pretty powerful stuff, right? Of course, like with any medication, there can be side effects, and some people are allergic to penicillin, so it's crucial to talk to your doctor before starting any new medication. Next on our list are the cephalosporins, another big family of antibiotics that work in a similar way to penicillins by disrupting bacterial cell wall synthesis. Now, cephalosporins are pretty cool because they're divided into different generations, and each generation is a little different in terms of what it's most effective against. First-generation cephalosporins are typically used for skin infections and some urinary tract infections. Second-generation cephalosporins can tackle some more serious infections. And then you've got the third and fourth-generation cephalosporins, which are the big guns reserved for some of the toughest bacterial infections out there. Cephalosporins are commonly prescribed for pneumonia, which is an infection of the lungs, staph infections, which can affect the skin, bones, and other parts of the body, and ear infections, which are particularly common in children. Let's move on to macrolides, another important group of antibiotics. Now, unlike penicillins and cephalosporins, macrolides work by inhibiting bacterial protein synthesis. Think of it like this. Bacteria need to make proteins to survive and grow, and macrolides basically throw a wrench in their protein-making machinery. Macrolides are a popular choice for respiratory infections like pneumonia and bronchitis, and they're also effective against certain skin infections and sexually transmitted infections like chlamydia. One of the most well-known macrolides is azithromycin, also known as the Z-Pak. You know, that one you get for a really bad cold or sinus infection. It's a powerful antibiotic, but it's important to remember that antibiotics only work against bacteria, not viruses. So taking azithromycin for a cold won't do anything except potentially lead to antibiotic resistance. Now, let's talk about fluoroquinolones. These antibiotics are like the special ops of the antibiotic world. They work by interfering with bacterial DNA replication, essentially preventing bacteria from multiplying and spreading because of their mechanism of action. Fluoroquinolones are reserved for more serious bacterial infections. Urinary tract infections, or UTIs, are a common reason why someone might be prescribed a fluoroquinolone. These infections can be really uncomfortable, and if left untreated, they can even spread to the kidneys. Fluoroquinolones are also used for bacterial prostatitis, which is an infection of the prostate gland in men, and certain types of gastroenteritis, which is an inflammation of the stomach and intestines. Last but not least, we have the tetracyclines, a group of antibiotics known for their versatility. Like macrolides, tetracyclines inhibit bacterial protein synthesis, but they have a broader spectrum of activity. One of the most common uses for tetracyclines is in the treatment of acne. That's right, those pesky pimples can actually be caused by bacteria, and tetracyclines can help to control the bacterial population on the skin. But tetracyclines aren't just for clear skin. They're also used for Lyme disease, a tick-borne illness that can cause a range of symptoms, from a rash to joint pain and even neurological problems. And finally, tetracyclines are sometimes used for certain respiratory infections, especially in people who are allergic to other types of antibiotics. And there you have it, a crash course on the different classes of antibiotics and their uses. Remember, antibiotics are powerful tools in the fight against bacterial infections, but they are not a magic bullet, and they should always be used responsibly. Misuse and overuse of antibiotics can lead to antibiotic resistance, which is a huge threat to global health. When bacteria become resistant to antibiotics, it makes it much harder and sometimes even impossible to treat infections effectively. So always consult with your healthcare provider before starting any new medication, and make sure you understand the do's and don'ts of antibiotic use. If you found this video helpful, be sure to give it a thumbs up, subscribe to the channel, and hit that notification bell so you don't miss out on any future health tips and information. Until next time, stay healthy, everyone.